When you think about treatment for cancer, you probably think about chemotherapy and radiation. But what you may not realize is that physical therapy plays a huge role in recovery. Now, according to the team at Aquacare Physical Therapy, a big concern after cancer-removing surgeries is lymphedema, which you, of course, know is the accumulation of fluid that results when the lymphatic system just isn't working right.
Yeah, and it can cause major swelling, which can wreak havoc on daily life. Well, fortunately, the team at Aquacare can help.
Yeah, that is right, Jimmy and Lisa. They actually work with patients to manage symptoms and improve their quality of life. And we're going to introduce you to a woman who can back that up. And when you hear from some of the Aquacare team members, it'll be most evident that this is a community that cares. It was at the beginning of last year that Lori Beer's life changed drastically. After having had an uneventful mammogram months before, she found a lump in her breast.
They did an ultrasound, and that's when they saw it. So that was a Thursday. By Tuesday, I had a biopsy, and by Thursday, the next Thursday, I knew I had cancer.
After multiple surgeries, chemotherapy, and radiation, Lori became cancer-free. But the havoc the disease wreaked on her body wasn't anywhere near done.
I could barely get around the block without losing my breath. The chemo was just exhausting, and the radiation was exhausting, and then, you know, cancer was kind of cruddy too. So all of those together, I was really, really weak.
Plus, she lost significant movement in her right arm, which turned out to be lymphedema.
Lymphedema is a type of swelling that can occur in an arm or any body part really after there's damage to the lymphatic system, including breast cancer and treatment for it. And what happens is the damage or the surgery causes the lymphatic fluid to stop flowing properly, causing this backup and then the swelling.
Sue Conklin is a physical therapist and a certified lymphedema therapist at Aquacare Physical Therapy. The practice is serious about this specialty.
It's such a great population to work with. It's underserved. It really makes such a big difference in those women's lives.
Megan Moss is a physical therapist assistant and a certified lymphedema therapist. She says physical therapy is critical after surgery. Here, they'll start with an evaluation.
After the evaluation, we put together the treatment plan, which will involve different things such as, again, stretches, different exercises. It's all very catered to the individual, so not everyone will need the same thing. And we usually do include some amount of massage, whether that's to reduce soft tissue restrictions or to address scar tissue that can form after surgery.
They did a lot of work on my range of motion, lots of different exercises, massage, and dealing with, because the pain was back here as well as underneath.
Aquacare Physical Therapy also empowers patients to tend to that pain after their stint here is completed.
Patients will get an individualized home exercise program they can continue to perform. They also will learn how to do the manual lymphatic drainage. They will probably get a compression garment that will help them get fitted, and then they may get a compression pump if it's indicated.
Physical therapist Ashley Christensen recommends a pre-screening for those about to undergo surgery.
It gives us a chance to get baseline measurements of their range of motion, their strength, the size of their arm or leg, and it also lets us educate them about the surgery that they're about to have. We can teach them a home exercise program, and we can teach them about signs and symptoms to look for lymphedema in the future.
Lymphedema isn't the only threat. Physical therapist assistant Melanie Blankenstop says chemo-induced peripheral neuropathy is a disorder of the nerves that occurs because of chemo damage.
It can get pretty painful, and then it causes them to have strength and balance disorders as well. So we deal with a little bit of trying to manage pain as well as strengthening them. Another way that we can treat it is by something called the Rebuilder. It's a low-frequency electrical stimulation, and it can be used on the hands and the feet, and it replicates the normal healthy nerve pulses to help reduce their symptoms.
When you think about it, it's not fair that though the cancer can be gone, the pain often isn't.
I did not realize all the things that I will have to keep in mind for the rest of my life. Okay, and that kind of sucks, but cancer sucks. So deal.
Fortunately, Lori and others don't have to deal alone. This crew loves to care for them tenderly.
They've kind of been like poked and prodded and, really not treated too nicely with their cancer treatment, which is just sometimes part of it. So that nurturing touch just makes a big difference to them.
If I knew what I know now, I would have had physical therapy probably set up from way earlier.
Because it's a huge part of helping the body heal. And Lori said something she also appreciated about Aquacare was that she was never pushed to work harder than she was able to. She said the staff met her where she was each and every day. And of course, if you're interested in making an appointment, you can do so online or by phone. You can find all that on DelmarvaLife.com.
Wow.
I never knew about this program, and I just think it's amazing what it can do for folks who have already been through so much.
Yes.
And in this part of recovery.
You really don't realize how much folks go through when they're treating cancer.
Exactly.
And the personal touch, the personal care is huge.
Absolutely.
Thanks for that, Katie. Thank you.